Now, I've talked about the two mainstays that I support for a large prostate: robotic simple prostatectomy and HoLEP. There is a third, and that's also marketed, and it's becoming more popular, that I don't favor, called Aquablation. And this on paper sounds great. It sounds like it's a quick procedure. It's done in the hospital. It really is robotic. It's autonomous. You set the machine and then you press a button, and it's going to use a very strong water jet. Some people will know it as a water pick for their teeth. And it's going to basically blast the prostate tissue apart. Now, if I didn't know how to do a robotic simple prostatectomy, or didn't have anyone in town here in DC that I could refer to that does an excellent HoLEP, I probably would have to do aquablation, because that's what will be left on the menu for a large prostate. So if you're seeing a urologist where that's what their skill set is, that's what you'd be offered. I don't offer that. I did attempt very much to embrace that. It sounded perfect. I like to embrace the new technology. I like the technology. The problem is the degree of bleeding that happens afterwards. You're not cauterizing anything. It's a very bloody procedure. And there are some modifications to it that they've come back to try to do, where in essence you're doing a partial TURP on these patients at the end, which really negates the whole purpose of why you're doing a minimally invasive procedure in the first place, where it's cut down on the bleeding, but nevertheless, there's still a very significant risk of having to be taken back to the operating room because you're in shock and there's so much hemorrhage, you're getting blood transfusions. For me, that's not really a minimally invasive procedure, and the transfusion risk and the blood loss so exceeds what would occur with a robotic simple or a HoLEP, that since I have in my skill set to do a robotic simple, I've not embraced aquablation, and I don't recommend it for my patients.